Yes, my name is Megan. I'm a public affairs specialist for Social Security. I've been with the agency for over 21 years, and I cover a large area of northern, north central Illinois. And what I want to do today is just go through an overview of our programs with you, and I'll be free to take questions at the end. You can put them in chat as we go along, but I do want to reinforce not to put any personal information like dates of birth, Social Security numbers, things like that in the chat. Okay, so we're going to go ahead and get started. And the first programs I want to talk to you about are our disability-related programs that we have through Social Security. And to start off, just an explanation of what we consider disability to be through Social Security, because our definition is specific to the Social Security Act. So there's other programs you might be familiar with, or maybe somebody's receiving VA disability, but not Social Security disability, or maybe they receive both, but there are different sets of rules for different agencies. And the way that Social Security defines disability for an adult, which is as soon as anyone's 18 or older, is a person who cannot work due to severe medical condition or combination of conditions that has lasted or is expected to last at least 1 year or result in death. So something like a terminal illness for the latter. And again, someone doesn't need to be off work for a year to apply for disability. It's just the expectation is that it's a long-term disability. And the second part of that is that these conditions are preventing what we call substantial gainful employment, substantial gainful work, or substantial gainful activity are all different terms that we use for the same premise. And that includes work that someone has done in the past or a type of work that they could adjust to and continue to do into the future despite medical conditions. So substantial gainful employment or substantial gainful activity, and in the government, we have all kinds of fun acronyms. So we call that SGA for short. That's the term that we use for deciding if someone is able to perform the level of work to be found disabled. So this year in 2026, for most everyone, what they're looking at is a long-term condition that prevents a person from working and earning $1,690 gross per month. So that's the substantial gainful activity amount for 2026. The exception to this is if someone is found disabled with Social Security's definition of blindness, and then that would be a higher amount of $2,830. Now we're going to talk about two different programs under the umbrella of disability that Social Security administers. But for both of these programs for adults, the medical definition is the same that we just covered. So the first program we're highlighting is Social Security disability. This is the SSDI for short. This is a program that someone works and pays Social Security taxes into. So most of the time when we're working and paying those Social Security taxes that come off our check, we're thinking about the future to our retirement. But also if someone should become disabled prior to their full retirement age, so even if 62 or 63 in the early retirement categories, but under their full retirement age, someone can apply for Social Security disability insurance if they have a work history. So again, we talked about the medical definition, and then the key to Social Security disability is that there's enough overall work and earnings into that program. The other program Social Security administers based on disability is supplemental security income, or what we call SSI for short. So with SSI, there is completely different set of non-medical rules. So the medical definition of disability is the same, but for SSI, the non-medical requirements are completely needs-based. So someone needs to have limited income and limited resources to qualify for SSI. Another difference with SSI is there are benefits for children with disabilities with the SSI program, and there's benefits not even needing a disability decision, but for anyone 65 or older that meets the income and resource requirements, they can have SSI as what we call an aged benefit. So just a little breakdown chart of the differences between Social Security Disability Insurance, or SSDI, versus Supplemental Security Income, or SSI for short. Again, Social Security Disability, that's coming from the Social Security trust funds that we're working and paying into when we pay our Social Security or our FICA taxes into the system. Whereas SSI comes from a completely different fund. It comes from a general treasury fund, not the Social Security trust funds. SSI payments are not based on a person's earnings, where the amount that someone receives from SSDI is based on what the person has put in as far as earnings. And for SSDI, that is, again, a benefit someone's eligible for that meets the medical definition of disability, regardless of income and resources. So someone can have a mansion that they live in and have 12 vehicles and $100 million in the bank and still qualify for Social Security disability. Whereas SSI is a needs-based program that has a very limited income and resource requirement to qualify for it. Social Security disability can be paid to a worker, and as we'll talk about later in the retirement section, also minor children, spouses, or disabled adult children can receive off of the worker's record. Whereas for SSI, it's just for the person receiving the benefit based on the disability, but it can be for a disabled child or a disabled adult in financial need. And moving on to the programs associated most with Social Security that people are often thinking of us with, and that's our retirement and related programs. So for retirement, and this is also how you get insured for Social Security disability by working and earning in credits. For Social Security disability, you have to have enough overall work and enough recent work. Whereas with Social Security retirement, you just have to have enough overall work, and that is having earned 40 credits. So having at least the minimum that would take is 10 years of work and being 62 years of age or older. So what's a credit? Well, a credit is something you earn with this year in 2026, each $1,890 in Social Security tax earnings that you pay in. And you can make up to 4 a year. So that's why we say 10 years of work minimum, because you have to have at least 40 for that retirement benefit. So we used to send out statements every year that had your earnings history on them. And I remember I was maybe 26 years old when I got mine, and that I had my 40 credits already. And that's because even in 2026, and this was way earlier than 2026, but in 2026, you only needed $1,890 for that one credit. So back, in 20 years ago, almost, when I got my statement that showed that I was insured for benefits, it was much lower because this amount increases every time we have a cost of living increase. So it doesn't take a lot of earnings to get insured for retirement. But again, just like Social Security disability, the amount you receive is going to be based off what you worked and paid in to Social Security. So while you only need those 40 credits, when I was looking at my statement when I was 26 years old, my monthly benefit wasn't very high because I'd only been working overall for 10 years, but a lot of those years were I was in high school and college and not working and making very much. And how we determine your retirement benefit is we take your wages and we adjust them for inflation. So we adjust them for the changes in wage levels over time. Then from there, after we've taken into account the inflation, we find the monthly average of your 35 highest years of earnings. Now, some people might not have 35 years of earnings, so you might have 0 years in that computation. But we're looking at your 35 highest years of earnings From there, we get your average index monthly earnings that we apply a formula to. Now, if you're really into doing math, we have the calculations on how you can index your earnings and figure out your monthly benefit that way. But toward the end, I'm going to show you the much easier way to get your benefit estimate, and that's through your online My Social Security account. A lot of times people will contact Social Security and they will ask, when should I start receiving benefits? Or my friend said I should start receiving benefits, or my sister just started receiving benefits. Should I start receiving benefits? And really, the thing is, we can't tell you what to do. I can tell you the earliest you can draw your retirement is 62. I can tell you the latest you want to wait to draw your retirement is 70, because that's when it no longer has any advantage to waiting past it. But everything in between is going to be based on a variety of factors in your life. Some people consider what other savings and investments they have. Some people are looking at how long they're going to be working and paying into Social Security, or just working in general. Others, might look to draw early so you can enjoy your retirement and maybe start traveling, or watching the grandkids, or whatever your retirement plans are. Some people might be working till Medicare age, which is age 65, as we'll discuss. And all of those plans are things that we can't advise on. So what's the thing we can tell you is what your amount would be every single month between 62, so the earliest you can draw it. And then your next major benchmark is full retirement age, which in this example, it's 67, which is a lot of our full retirement ages. And then on up until it continues to grow every single month up until 70. And between full retirement age and age 70, you're earning what we call delayed retirement credits. Those average around 8% per year. So once you take a benefit reduced, it stays reduced based on that age-related reduction. So somebody taking it at 62, in this example, do $1,400 a month. When they hit their full retirement age, it won't go up to 2,000. It's still going to be having that age-related reduction because they took the benefit at 62. And you might say, well, why would somebody take it at 62 when if they wait till 70, it's over $1,000 a month more? Well, one of the things to consider is how much money you would draw between 62 and maybe your full retirement age for that 5 years, or that 8 years if waiting till age 70. And a lot of times the money that will be collected versus waiting, it might be 15 to 20 years till somebody hits their break-even point where it was no longer advantageous for them to have taken the benefit early. And so that calculation a lot of times is where people look into the longevity of their family in making that decision and expectations for their own lifespan. But again, these are all factors to look into, but Social Security cannot tell you what to do. We need you to make the decision on when to draw the benefit. Here's a chart where you can find your full retirement age. But if you were born 1960 or later, I'll make it easy. Your full retirement age is 67. So that's my full retirement age. If I should go ahead and take it at 62, I'm going to see a 30% reduction. And if you were born prior to 1960, you can find your corresponding full retirement age here. One of the factors in deciding whether people take their benefit early is if you're still working, because when you are under your full retirement age, you have a monthly earnings limit. So this year, someone who is before the calendar year they turn their full retirement age, the earnings limit is $24,480. After that, we hold $1 for every 2 that you go over the limit. So what does that mean in practicality? So when you are filing for your benefit, one of the questions we ask is if you're working and how much you're working, gross wages. It's either gross wages or net earnings from self-employment is what we're asking for. So we're not considering any other income, gross wages or net earnings from self-employment. We're going to ask you for an estimate if you say you're still working. So let's kind of go over an easy example here. Let's say someone contacted us They turn 62. Let's see, we're in the month of June now already. So let's say they turn 62 in the month of May, and you have to be 62 an entire month. So June would be the first month they were eligible for a retirement check. And they contacted us and said, I want to start my Social Security. And we ask about the work, and they say they're making exactly $20,000 over the earnings limit. So they're making $44,480. So what we would do if they decide to file is we're going to look at half of that amount, right? Because we're holding $1 for every two of that $20,000. So they're $10,000 over the earnings limit that we have to hold in benefit checks because they're working and making that amount. So for this person in this example, we'd have to, let's say their monthly benefit is $2,000 a month. We need to hold $10,000 in checks. So we're going to hold 5 benefit checks. So they said they want to start their checks with June. So we're going to hold June, July, August, September, and October benefits in what we call work suspense because they're working and making over that limit. The first check this person would be due in this scenario is November, paid in December because all Social Security checks run a month behind. And they would be starting at the June 2026 reduction, age-related reduction rate. So they might say, you know what, I'm going to wait and to draw because I'm not going to be receiving enough money to make it worth it this year. But let's say they do go ahead and take their benefit amount. Well, in that situation, like I said, they're going to be due their first check November, paid in December. And then next year, if still working, they're still under their year, they turn their full retirement age. So we would do that all over again. And then at full retirement age, what we're going to do is we're going to readjust their monthly benefit as if they had taken it later. So if it was only the 1 year they worked and we hold those 5 benefit checks, what we would do is we'd actually start them at the November, we would increase their benefit to what the November of 2026 benefit rate would be because we're limiting some of those age-related reductions. But again, that adjustment will not happen until full retirement age. Now, the year you turn your full retirement age, you can see quite a bit higher of an earnings limit. So let's say that person contacted us in January with the same earnings, the $44,480. They contacted us in January, but they're turning full retirement age in June. Well, they could make up to $65,160 just between January and May. So they're going to be under the earnings limit in that scenario. So they would receive all their monthly benefit checks, even though they're working and making that 40-some thousand dollars because they're hitting their full retirement age. And the first day of the month in which someone hits their full retirement age, you can work and make as much as you want and still receive all your Social Security checks. Now you can see with these work earnings limits that there is a monthly figure under that. That is because in the year that you retire, you have 2 different options. We can use the yearly, which we did for that example because the person was going to work throughout the calendar year. But let's say another scenario, that same person, that 44,480, but when they called us, they said, I'm working January through May and I'm retiring at the end of May. Well, then we're going to go ahead and start their checks with June. Because of their fact they're retiring, they're going to be under the monthly limit, which is just the yearly divided by 12 for every single month for the rest of the year, as long as the person's under the monthly limit. It does not matter how much they made prior to filing. So that person could have made $100,000 between January and May, as long as they're going to be under $2,040 a month for June through every single month for the rest of the year. We can pay all the checks. So that allows people who have been working to retire mid-year and not have to worry about that earnings limit. Same thing for the year you turn your full retirement age with that higher limit. The monthly limit is $5,430. Now, as I kind of hinted to earlier in the disability section, Whenever a worker files for benefits, we're going to screen for benefits for other individuals off of that earnings record. So for children, a child must be under 18, first of all, unmarried, under 18, still in high school up through grade 12. So we don't pay past grade 12. But it's rarely common for someone to turn 18 in their senior year of high school. So we can continue to pay up until the end of the school year or age 19, whatever comes first. And then the final category is one to really think about when you're completing your application. 18 or older and having a disability that began prior to age 22. So you might have an adult child who's 35, 40 years old at the time you go to file for your retirement benefit with Social Security. If that adult child is unmarried and has had a disabling condition that began before age 22 and they're not, haven't been working substantially, then you want to list them down on your benefit, and we'll go through a disability application to see if they'd be eligible for disabled adult child benefits. So these rules for the children are the same whether a parent is on disability, retirement, or a parent has passed away. First category of spousal benefits we're going to talk about is benefits for a current spouse. So first of all, if both spouses or both members of the couple have their own 40 credits, we always have to look for a person's own benefit before we can pay anything off a spouse's benefit. So we're going to look at 100% of a person's own benefit and 50% of the spouse's full benefit. And this is full retirement age rate. Even if a person is filing early, we're looking at 100% of the person's full retirement age rate and 50% of the spouse's full retirement age rate. We are not going to consider a current spouse benefit until both members of the couple are applying or if one's already collecting a benefit, because we cannot pay a spousal benefit and a current spouse a benefit until the worker themselves collects. Spousal benefits need to be age 62, just like a retiree, unless caring for a child of the worker who is under 16 or has a disability, then you can be under age 62. The benefits will never reduce a worker. And then we're going to start at that 100% and 50%, but we're always going to reduce it if, just like we talked to person's own, a spouse's benefit would be reduced if earlier than full retirement age. So let's go through an example. Let's say my monthly benefit, my spouse and I are both filing. My full monthly benefit is $3,000 a month, and my spouse's full monthly benefit is $1,000 a month. Well, in that scenario, they can get up to $1,000 on their own if they're at their full retirement age, and up to $500 on mine. So they're not going to get $1,500 on mine. They're going to get up to $1,000 on their own. And then the difference between their own and 50% of mine off my record. And then again, if not full retirement age, it'll get reduced below that 50%. Both records would have an age-related reduction. So it would be less than the $1,500. But let's say my full benefit is $3,000 a month and my spouse's full benefit is $1,600 a month. There's going to be no spousal benefit payable because 100% of their own is more than 50% of my own. Next category is divorced spouses. There's some similarities and there's some differences with this. So for divorced spouses, a marriage has to have lasted at least 10 years. The former spouse has to be unmarried, so you can't file off your divorced spouse who's living if you're currently remarried to someone else. You must be age 62 years of age or older for benefits for a divorced spouse. And the final thing is we're going to consider the person's own benefit before considering anything off a divorced spouse, just like we do with current spouses. But the big difference with divorced spouse benefits is that the divorced spouse does not have to be collecting a benefit. They just have to be eligible to collect a benefit. So let's say you're turning 62, you haven't been remarried, and you were previously married for more than 10 years, and you're going to file for your retirement benefit. Your ex-spouse is not filing or receiving a benefit yet. That's okay, as long as your ex-spouse is at least 62 and has their credits. We're going to look to see if you're due anything off your record. We'll look at 100% of your own and 50% of the ex-spouse's benefit to see if there's anything additional to collect, even if, again, that ex-spouse is not collecting a benefit yet. So that's the big difference. For a current spouse, the worker has to be collecting the benefit. For a divorced spouse benefit, that is not the case. The worker does not have to be collecting. They just have to be eligible to collect. The final category of money benefits we're going to talk about is survivor's benefits. So rules for children are the same as we talked about, under 18 through grade 12 and up to 19, disabled prior to age 22. But for surviving spouses and for surviving divorced spouses, it's different than for when someone passes away versus off someone who's living, because you can get that benefit as early as age 60 or as early as age 50 if having a disability, or at any age of caring for a child of the worker who passed away who is under 16 or has a disability. The other thing is, with survivor's benefits, you can remarry if the remarriage happens after age 60 and still continue receiving survivor's benefits or be eligible to receive the survivor's benefit. So the other difference with survivor's benefits is how much you can receive. So we're looking at that 50% off a spouse or divorced spouse. Survivor's benefits, it starts at 71.5% at age 60 and goes up to 100% of the worker's benefit at full retirement age. So again, just a little breakdown for you of the difference off of somebody who's living versus someone who's passed away. A spouse or divorced spouse off someone who's living needs to be at least age 62 unless the current spouse has that child in care. And it's 50% or less of the benefit that they're eligible to receive of the worker, whereas survivor's benefits as early as age 60 or 50, again, earlier if having a child in care, and 71.5 to 100% of the benefit. So there's a lot of situations where there's no spousal benefit payable because each person has their own earnings record and there was nothing additional payable as a spouse. But then if the higher earner passes away first, the spouse or the former spouse would want to contact us to file for the survivor's benefits, because then we can move them to that higher benefit record. So with survivor's benefits, it's an exception to that policy that I was discussing with spouse's benefits. So remember I said you need to be able to, or you have to take your own benefit if you have your 40 credits before you can look at a spouse or divorced spouse's record who's living. That is not the case with survivor's benefits. So survivor's benefits, you don't have to take your own. You have some strategies here. So you could start taking survivor's benefits as early as 60 and then switch to your own record as early as 62 if yours is higher, but you don't have to switch just as soon as you're eligible. You could let yours continue to grow all the way up until age 70, or you could take retirement benefit at 62 and let the survivor's benefit keep growing until age full retirement age, and that's where it maxes out, and switch to the survivor's benefit at that time. So just some things to consider when survivor's benefits are in play. So turning now from the money benefits to Medicare, and just one thing I want to say about Medicare with Social Security is the only thing we do with Medicare is enrollment in Part A and Part B. So Part A, hospital insurance, this is as long as you have 40 credits from you, a spouse, or a former spouse, You pay nothing monthly for Part A. That would be inpatient. So it only covers inpatient information like stay. If you're overnight or longer in a hospital, it doesn't cover ER visits in and out. It doesn't cover anything else other than that inpatient portion. Then your Part B, with medical insurance, that's going to be a base premium this year of $202.90 a month. And it covers your outpatient visits, outpatient procedures, certain medical supplies, all kinds of things. On to that original Medicare, a little over 20 years ago, came Part D, or prescription drug coverage. So Part D is through private plans. So Social Security does not do anything to enroll or work with Part D. And then people can also go through an insurance provider to get supplemental insurance, anything with a letter above D, and that comes into play as a wraparound coverage to the Medicare Parts A and B. Then increasingly popular are Medicare Advantage plans. You still need to enroll with Social Security in the Part A and the Part B, but after enrolling in A and B, rather than going through Medicare for all your questions and billing information, you would go through your Medicare Advantage plan directly. Some people like the Medicare Advantage plans because they have things like having your Part D plan already figured out alongside it for you, and maybe extra benefits like vision, hearing, dental, and more. There's like healthcare, there's like exercise benefits to some, different things. So that's why people look at those Medicare Advantage plans, and some also lead to lower out-of-pocket costs. So as far as when you can get entitled to Medicare, after 24 months of that Social Security disability, remember that's the one you've worked and paid into, you're eligible for Medicare. Also, individuals who are found disabled with ALS, they do not have the 24-month waiting period. They have Medicare right away. We have a special policy called end-stage renal disease that's for individuals with permanent kidney failure. And then the big time otherwise that people are thinking about getting on Medicare, the earliest you can get it based on age alone is age 65. As far as when you can get into Medicare, your first opportunity is your initial enrollment period. That's the 3 months before your birthday, 65th birthday, the month of your 65th birthday, and the 3 months after your 65th birthday. Now, if you are receiving a Social Security check prior to turning 65, you will automatically be enrolled in Part A and Part B. If you're receiving a Social Security check, you have to have the Part A, but you might be able to refuse the Part B. So that's the category I'm going to jump down to and talk about next. But first, I want to say, if you're not receiving Social Security benefits, there's nothing magical that happens to put you in Medicare at 65. So if you need Medicare at 65, you need to make sure you apply for it in that initial enrollment period. Now, if you apply in the 3 months before you turn 65, it'll start the first day of the month in which you're 65. If you wait till the month of your birthday or the 3 months after, it's going to start the month after you apply. Then jumping down to special enrollment period. So as I said, you may or may not need that Medicare, especially the Part B at age 65. This is dependent on if you qualify for a special enrollment period. So a special enrollment period would be for individuals who continuously, for every single month, from 65 until the point that the special enrollment period begins, have coverage on a current employer. So that's a key. Active employment. It can't be a retiree insurance or a marketplace or anything like that. Active employment and a group health plan through that employer. So for instance, I'm currently working, obviously, here at Social Security. I have Blue Cross Blue Shield. So if I was 65, I'm currently working, I have employment through Social Security. I have my insurance through Social Security. I wouldn't have to take Medicare, or if I got enrolled in Part A, I could refuse the Part B because I have that coverage. And this would apply if it was my own employment current employment and coverage or a spouse's current employment and coverage. In that situation, you have a special enrollment period at the time the employment ends for 8 months. And we'll talk about when that coverage would begin in that special enrollment period in a moment. But before we do that, I want to jump back to that middle category, your general enrollment period. The general enrollment period would be for individuals who do not get into Medicare at age 65 and did not have a special enrollment period. So maybe you just misunderstood and didn't get in at age 65. Maybe you're someone that said, I don't want to pay $202.90 a month for Part B, so I'm not going to apply for that. Whatever the scenario might be, if you do not qualify for a special enrollment period, the only time to get back into Part B after age 65 is your general enrollment period. That's once a year from January through March. Coverage begins the year or the month after you apply. So January begins in February, February and March, March and April. And you'll have a 10% penalty onto the monthly premium for every year you did not take the coverage. So that's why it's really important to go through and make sure you're making all the right decisions on your health insurance when you're coming up on age 65. So as I mentioned, we talk about when the special enrollment period a little more, when your coverage begins, because this one's a little different, where the other two default to the month after enrollment. This, if you file for the special enrollment period to get your Part B on the first day of the month while you're still working or during the first full month after you're no longer employed, you can choose. Do you want to backdate it? So even though, say we're in the middle of the month and you apply, but you just stopped working last month, you can say, I want this to go back to the first day of the month. And this month, it would only be back one day to June 1st. But, even if we were on June 29th, you could backdate it to June 1st in that scenario. Or choose any of the following 3 months. So if you stopped working in May and you contacted in June, you could do it with, if you contact us in May for it, you could choose go back to the first day of May or June, July, August. Or once you get past that first month after you're no longer employed, the rest of the 7 months, it's automatically going to begin the month after you sign up. Now, as I mentioned, the base premium for Medicare Part B this year is $202.90. Some individuals pay more. So sometimes you might end up paying more for 1 year because you had a one-off. I'll give you an example. My dad sold farmland in 2024. So that went into his modified adjusted gross income. And when he got his Social Security check, he was texting me, why is my Social Security check so much lower this year? Well, it's lower because you have an additional Part B premium, Dad, and we would have sent you a letter. He didn't open his letter. A lot of people don't. It's really important to open your mail so you're aware of what's happening. If you are in these categories where you are more than 109,000 or 218,000 if married, and filing together for your modified adjusted gross income, and it defaults to 2 years prior. So like my dad discovered it was his 2024 income, then you are going to get a letter about your income or your additional Part B premium, I'm sorry. And you can find on the chart where you would land on that. That letter, though, will also explain there's some situations where you could ask us to use a different tax year than 2 years prior. Now, this hasn't applied to my dad because he didn't have a life-changing event, but the letter will walk through the life-changing events. And so one of the more common life-changing events, I'm not going to go through all of them because I'm going to trust you all to open your mail and look through them, is work reduction or work stoppage because you're at retirement age, right? So let's say you are in that higher Part B category, but you stopped working last year at the end of 2025. What you could do is there's a form, an SSA 44, that the letter will explain to you that you can get online or through your local office, and you complete that and you return it right away because we're only going to protect you with the date you return the form. and you return the form that says, I want you in that situation, since you just stopped working at the end of 2025, I want you to use the estimate of my modified adjusted gross income for 2026, and you provide that and proof that you stopped working, maybe a letter from your employer, and we can use that to do a life-changing event and adjust your premium. But the only time we can adjust those is when you have one of those life-changing events. If you're wanting to apply for Medicare only, that's really easy. Usually takes 10, 15 minutes. If you're already on Part A and you want to just add the Part B, that's just 2 forms we need. A CMS 40B, which is the form that says you're ready for your Medicare Part B to start, and the CMS L564. These are for your special enrollment period. The L564 is the one that you or your spouse's employer is going to fill out, and it's going to prove that you've had that health coverage to allow for the special enrollment period. Those can then be mailed, faxed, or uploaded online. For everything Medicare related, aside from enrolling in Part A and Part B, we're going to direct you to the Medicare.gov website. Just like Social Security, SSA.gov, make sure you're always going to the .govs for our websites, Medicare.gov, SSA.gov, IRS.gov. Just always make sure it's a .gov, not a .com or .org that could be trying to scam you. And if you need help getting a Part B, or not, sorry, Part B, a Part C or a Part D plan, or you have questions about benefits, coverage, premium deductibles, coinsurance, complaints and appeals, all the things that Social Security cannot help you with, we recommend you find what we call is a SHIP counselor, the State Health Insurance Assistance Program. They're wonderful, trained by the State of Illinois Department on Aging, free to use service that can help you wade through all this complicated Medicare stuff. And most senior centers and other types of agencies, sometimes even hospitals, have these trained SHIP counselors. You can find a list on the Medicare.gov website, or if you Google Illinois SHIP counselors, you can go right to the Illinois Department on Aging, and they have a list by county. So those are some options to find your local SHIP counselor. But I do recommend, if you need help with all of this, because they're trained to help you find the best plans for you. They're not a private entity trying to sell you a specific plan. So they'll go through, like for Part D, your medications and all that with you to help you find the best plan for you. As far as applying for all the programs we talked about today, except survivors, the best way to accomplish that is online. You can file for retirement and spouses, disability, Medicare only. And new to this year, the lump sum death payment, which is a one-time payment of $255, eligible to a current surviving spouse or a minor child or disabled child on a record when someone passes away. That is available online. It just came online this year. If you have a disability and you're between 62 and full retirement age, you can apply for both disability and you can file for your retirement while you wait on that disability decision if you want, because you might need that income. Disability decisions take anywhere from 6 to 12 months. So you can get both going, both the disability application pending and your retirement benefit in that scenario. And you can do both of those online. Again, what not available yet is the survivor's application. So if you need to file a survivor's application or you are not able to use our online services, then you need to call to schedule a phone appointment. You can call our toll-free number, 8 a.m. to 7 p.m. I recommend calling first thing in the morning if you're able to. That's the easiest way to get through more quickly. That's 1-800-772-1213. And they're open except for federal holidays, that Monday through Friday, 8 a.m. to 7 p.m. Or if you are unable to use phone service, maybe you have a barrier to phone service. In that scenario, you can call and schedule an in-office appointment, but you do want to schedule that appointment, and you'll just want to explain the reason for needing the in-office appointment. The reason we're trying to really do the majority of appointments over the phone is partly because we are sharing a lot of work between offices. We have some offices that don't have any appointments available, in the next 2 months. So maybe we can have another office helping take appointments. And so that phone appointment option allows us to do that. Here is what the SSA.gov homepage looks like. So again, when you're making sure you're going to the right site, make sure you're seeing this picture in front of you. Make sure you see the official Social Security, that you see the .gov, and that you're seeing this information so you know you're in the right place. There's a lot of great information and resources. I encourage you after this to spend some time checking out our SSA.gov. We have a nice search box where you can search different topics, navigate through different benefits, things like that. And then we encourage everyone 18 and older to create an online My Social Security account. And there's a lot of great reasons to create one of this account. If you want information, there's some YouTube videos that help you with the creation of the account that you can access, like which one should I choose, login.gov or id.me. Spoiler alert, a lot of advocates have told me id.me seems to be going a little bit more smoothly. If you click sign in, or if you click create an account and you keep clicking create an account, it's going to be direct you to login.gov. So if you want to do id.me, you're going to click on the green one when you get to that. But either one that you choose, you're going to be walked through the steps if you don't have an account yet. If you have a login.gov or id.me already, go ahead and click sign in, and then it's just going to link your My Social Security account through the final steps. But if you need to first create the account, if you don't have one of those, then it'll bring you back to finish linking your My Social Security account to it. But once you have the account set up, a lot of great features there. Even if you're not on benefits, I have had an account for years, because this is how you review your earnings record every year now. So you want to make sure there's no earnings missing. This is how you receive your retirement estimates, your spouse's estimates, the survivor's estimates. Should you pass away, you would know what your family would be due. You can request a replacement Social Security card online most times if you have a valid driver's license or state ID, completely online, skipping a visit to the local office. You can check your status of your application or appeal. You can get that Social Security statement. So you'll have your earnings broken down by year on the screen, but it'll also have a PDF option for your Social Security statement that you can, if you're on a home computer, you can print or save it. A lot of times I've been told financial planners want you to bring those Social Security statements to your financial planning appointments. So that's just an easy way for you to get that. And again, you want to review your earnings record, make sure nothing's missing. Get us a W-2 if you have any years missing. Once on benefits, a lot more you can do. If you're on Social Security, disability, or SSI, you can report your wages. You can change your address, phone number, or direct deposit if you're on Social Security, benefits of any kind. If you hear someone say, I need an award letter or I need proof of income, we call that a benefit verification. A lot of agencies ask for that, things like energy assistance. If you're getting a loan from a bank, places like that will ask for it. And you can print that right from your online account. We have something called advanced designation, which basically we ask you if you should become unable to manage your finances and you need a representative payee, who would be best to do that. You can submit that online or update your person that you have listed. You can replace your Medicare card online, can print proof of having your Medicare. Say you have an appointment that day and you can't find your Medicare card. You go in, you can ask for a new Medicare card. That's going to take a few weeks though, so you can then print your proof that you have the Medicare also online. And we just wrapped up tax season. You can get a new replacement 1099, and you can get up to 6 years prior 1099s as well. And if you're on disability, you can even complete your medical reviews online. So, oops, we went over that information, how to create an account already. Here's that Social Security statement. So that's the one where we used to send it out in the mail every year. We no longer send it out in the mail unless you are 60 or older and have never created an online account. You do not want to find out at age 60, if you're like, say, my age now in my 40s, that I'm missing earnings from 15, 20 years ago. So that's why we encourage all young people to create one of these accounts as well. And then, like I said, this statement would be what a lot of times financial planners ask you to bring to your appointments. If you do have to visit an office, we are appointment focused, which means most offices will ask that you have an appointment prior to walking into the office. Once you do have that appointment, though, and you go into the office, you can get an option to check in on your mobile phone. That's easiest. If you don't have a mobile phone to check in on, you're going to be able to check in at the kiosk at the local office. And we are on social media. So if you want to keep up to date with the most recent information on Social Security, you can follow us on Facebook, X, Instagram, LinkedIn, and YouTube. And then we'll go through any questions you have.